Hello, folks. I am back, and most of the people that subscribe to me know that I'm primarily a firearms channel. So I haven't been able to do any firearms work in the since August of this year. I had some issues with my knees. I had these ongoing problems with my knees for over 10 years. It could be from I was in law enforcement for 27 years, so I had a lot of problems. And also, let's just say the truth. It could be age or arthritis. I'm 61 years old, and I had issues with my knees periodically. So let's go over some rules. Number one, let me give it as a disclaimer, I'm not a doctor. Number two, always follow what your doctors and your physical therapists and follow their rules regarding medication. And number three, this is based on my own experience. Everybody's situation is going to be different from what I'm telling you right now. You may have swelling or someone else may not. So there's a lot of different things that go on when it comes to knee replacements. The other thing is, just to give you proof of that, my late mother in 1998, she was 75 years old when she had both knees replaced. Like I said, I'm 61 now, and I asked my doctor, could I have both knees done? But they said, due to my situation, I had to have one at a time. So it's been 7 days now. I think I got the surgery around October 14th. And right now we are on the 21st. And my knee replacement has been doing very well. I've been able to walk pretty well. But the thing about it is, I will have to do this. I did this knee replacement. I'm rehabbing it now, but come January, I'm going to get the left knee done. So let's go over some things here. As you see here, this is a healthy knee. I got this off the internet. This is your healthy knee right here. There is space in between here because there is something called the cartilage. So that's how your knees are really supposed to be lined up. So this picture here are my knees. Now, my knees from this x-ray here, my knees are jacked up. You can see that. You can see how the bone is coming down and then it's going askew this way on both knees that you could see. I'm not sure. I believe this is the right knee. I'm not sure because that's the way they sometimes reverse the x-rays. They took it from a couple different angles. So this is what you see in my knees here. As you can see, right in this section here, if I could blow it up, there is no cartilage right here. So all you see is bone on bone, bone on bone. I believe this is the right knee because this one was a little bit more askewed on the side. And also the other issues that I was having, since it was bone on bone, I was walking with a gimp during my course of day at work. So these are the issues that you can have. And the thing about knee replacements, they are so commonplace. You can be as young as 35 and have to have a total knee replacement, or you can be older and have a total knee replacement. So this is my actual x-ray, and this is how they look. They look horrifying. So let's go to another picture. If this will work right, I'm going to have to do it another way. And of course, it doesn't want to work when you want it to work. All right, here we go. So this is what they show as far as a knee replacement. Again, this is a photo here. This photo here shows that this is a healthy knee. I believe this is supposed to be a healthy knee, but it doesn't look like it is. But they show you what has to be done. Now, if you look right here, in between these spots right here, your cartilage is worn down. So as you see here, your cartilage gets worn down and you don't have anything to give for that cushioning. So as you see here, that's the tibia and that's the femur. All this is grossly arthritic or worn down to the bone. So it's pretty much grinding. So there's no support there. So what they do in a knee replacement surgery is they take a metal piece right here and they stake it into the bottom piece right here on your tibia. They actually drill a hole. After they drill the hole, they stake it in with a hammer and mallet and so forth, and it goes right in there. They put in another like polymer or whatever material they're using, and they place it in between so there is some give and some friction. So what they have to do prior to that is they have to saw all this bad stuff right here, all the bad arthritic part. So this piece can go over here and you can have that polymer piece in between. And this one is designed to curve to mimic your bone, how your bone curves up. So that's what pretty much happens. And then as you see, the completed portion of when they have it so there would be no friction. Now, my procedure, before I got my procedure done, I was using, I have 4 things of the gel shots, and the gel shots are supposed to cushion that area. As you see here, with this situation here, they use, like I said, that synthetic to cover that space there. And so there can be some type of friction where smooth friction at that, smooth friction, so your knee can move properly. And they also hammer and stake that up top. Now, these surgeries usually last from anywhere, depending an hour to 2 hours, depending on the person. It's really amazing. One of the things is with my procedure, it was what they call robotic or computer done. So you can have the exact measurements and using a computer aid. So everything can be put in its proper space, like with manufacturing today, whether it's cars or whatnot. So the doctor is assisted by this computer, and he's also looking in. What they do is they will stake in 2 screws or to drill in, which works like a sensor, and then another 2 up here. So that way the computer can enhance the video through via the X-ray, if I'm saying that right, electronic X-ray and or regular X-ray. So that's how they have to do this procedure to have the surgery done. As soon as your surgery is done, you are, after the anesthetic is being worn off somewhat, you are asked to walk around. You're going to be aided by a nurse to help you go up a simulated flight of steps or whatnot. So they got you moving. You have to have your joints moving pretty much immediately right after surgery. You will be groggy. In my case, I did not feel any pain walking, and that's, like I said, that's all probably because of the anesthetic that they give you, but I felt like I was walking pretty much normal. So this photo here, this is a photo of me. I'm at home. This is probably the first day. What you see here, this is a box right here. This box is a cooling system. So this cooling system has a tube. Notice that this leg is not the leg that had any surgery, but it squeezes onto the calf. The other side is it'll have another one that's squeezing onto the calf, but you also have one that covers the knee. So to prevent swelling, you have to be able to have some type of the icing, which is very important. So the icing is supposed to help with reduced swelling. And I usually use this at a half hour every hour, or I can mix up the times depending on what my doctor recommends. And then I usually have to walk around. Now, you do, like I said, you still have to walk around. You have to do all those things to help your recovery work. Majority of the work is done with you at home. So when you're at home, you are to do the workouts that the therapist recommend. So I'm a little sore now because I had my therapist come by. He was doing inpatient therapy. And what he does is he tries to get you to bend that leg. It's not the knee that's the problem. The knee is working perfectly fine. It's just your muscles and everything is so constricted at this point because right now your body is saying to you, there's something in your body that doesn't belong there. So that's why the pain is there. The pain is there because it's trying to reject that metal piece, your knee replacement, because it's a foreign body. But it eventually adapts and adheres to it so it has something to grip on. It's going to take time. And one of the things that's most important about knee replacement surgery is that you have to be patient. You have to be patient, which is the number one thing. And I was kind of losing it because I want this thing over with so I could start on the next knee. But I have to be patient. I have to do the exercises that they require me to do. And you have to do those exercises at least a minimum of 3 times a day. And you're figuring that your body is already beat up. Why would you want to keep doing more and more exercises? And it can be a little frustrating, but once you're walking around, I'm walking around and I'm very happy, but you want a little bit more flexibility. You want that leg to be able to bend back and forth. I'm walking around with no problem, but I can't walk upstairs like I want to. I can step, but I got to take my time and I got to have the patience to do it. Like I said, you definitely have to follow your doctor's instructions as well as your physical therapist. Now, I'm going to show you where the incision was, pulling up my pants so you can see it. So I'm going to move this a little bit. Now, this is my regular knee. Now, this is regular knee. This is my knee that needs to have surgery on it. And this is the one I had the surgery with. Now, you notice when you compare the two, there's a lot of swelling. Your swelling is going to go up and down, up and down. Swelling can last on a total knee replacement. And I'm not kidding. Depending on your body, depending on who you are, the swelling can be anywhere from 3 months to a year, meaning that it has its moments. It's going to have moments where your knee has to get adapted to it. And usually people make a full recovery anywhere between 6 months to a year. So the key thing is, again, is patience. And there's going to be times that you're going to feel some pain. And the pain is usually the stiffness in the leg here. I'm trying to show you that sometimes there is a little bruising that comes up right around here. But as far as right in the kneecap here, I have no pain. It's all the hamstring. It's all in the calf. So eventually you have to work that and stretch that out and follow the physical therapist's instructions. The other thing about, I'm going to say, besides patience with doing this, is that you have to get in that right mindset. Don't get depressed over it or anything of that nature. You're also going to have to be able to be strong mentally, deal with the pain. I will be going to outpatient therapy next week, so that's what my therapist has said. But just remember, just hang in there. Just hang in there. You'll be okay. I'm losing my train of thought. There was something else I wanted to mention about knee replacements, exercising working on a diet. Diet meaning something that's, you got to have some type of fiber and or like, let's say berries or something, because they carry antioxidants that can help you with your recovery. There are a lot of other videos that are out there where people that talk about knee replacements, and I'm going to put in a actual surgery video. I linked it from another YouTube video. This doctor, she does very, very well explaining it. So parental discretion advised, because you might be a little squeamish. But like I'm trying to point out, everybody's situation is going to be different. Just work hard. It's going to pay off in the end. Like I said, the knee's not the problem for me right now. It's just stretching those muscles and to get them to work properly. Other than that, folks, I'm just hoping to get recovered. My goal is to have a decent amount of recovery. Like I said, recovery times can vary from 3 to a year as far as swelling and proper walking. My mother, it took her a year. So I'm trying to get to the point December of this year that I can be totally mobile like I want to be, with the flexibility, so I can start the other surgery January 2025. All right, so with that, folks, usually I use a montage for the shooting community. I'm just going to say stay safe, hang in there.